I'm Mr. Ferris. I'm going to be your nurse today. We're going to auscultate your lungs and listen to your lung sounds. Your right lung has 3 lobes, your left lung has 2. We're going to listen here, here, and that is your right upper lobe, left upper lobe. This is your right middle lobe, left lower lobe. Right lower lobe, left lower lobe. And those are the places we're going to listen. You can go ahead and you can take a deep breath in through your mouth and out. Okay. Okay. Then we're going to continue to do that. Down. And you do it over on the sides. Okay. Now, if you stand up and turn around, I can auscultate your posterior lung sounds. You do it here. And you also do it out here. Okay. Now on the back to auscultate the vesicular lung sounds, those are over here, and then you go in a pattern like this and down. And then to do your bronchiovesicular lung sounds, it's here and there. Now if you turn around and sit down for me, I can show your anterior vesicular lung sounds. That is these areas here, and then you're also going to go over to the sides. And then the bronchiovesicular would be here, and then here on the sternal area. Now I'm going to auscultate, or I'm going to listen to your heart, and I will say what part it is as I do it. So the first thing you're going to do is we're going to go to the second intercostal space down on your chest. And this is your aortic valve. And you go over to the other side. This is your pulmonic. Go down one. This is your Erb's point. If you go down another, that is your tricuspid. This is also the point of your apical pulse. And down one more is your mitral valve. And then I will assess your capillary refill on your nails. You just pinch down. It was less than 3 seconds. That's completely normal. You also are going to assess the color of the nail beds, the conditions of the nails, that kind of thing. His brachial pulse is here. His radial is here. His pedal pulse is right here on the top of his foot. And his carotid pulse is here. And this one, his apical pulse is mid-clavicular line, 5th intercostal space down. So it's right here. And then I'm going to look at his extremities, make sure that they are the same, that his pulses are the same, which they are. And I'm going to see if there's any swelling in his extremities. He has no swelling. Now I'm going to do his, I did his pedal pulse. Okay. Now I'm going to do his GI assessment, or abdominal assessment. The first thing you're going to do is you're going to visually look at the abdomen. You're also going to have your patient lay in a flat position. That way you can just sit up. You can sit up. But you're just going to look, that way you can see if their belly is rounded, which is distension, or if it's flat, which is normal. You're going to look for any visible scars, lacerations, anything like that. Any bulges, any like wave movements that are abnormal that you can visibly see on the abdomen. Then you are going to auscultate for bowel sounds, and you're going to start in the right lower, then the right upper, left lower. You're going to listen to each quadrant for 1 full minute, and Okay, you're gonna listen in each quadrant for 1 full minute. And so if you hear less than 5 vowel sounds in that quadrant, that means it's hypoactive. If it is 5 to 35 sounds in that minute, it's hypoactive. Wait, no, it's normoactive, sorry. And then if it's more than 35, then it's hyperactive. And then if you hear no vowel sounds in that minute, you're gonna wanna listen for a full 5 minutes in that quadrant. And I would also have another nurse help assess, because if there are no vowel sounds, that could be urgent. That could mean there's some sort of blockage or obstruction in the vowels. The second thing we're gonna do is, after we auscultate, we're going to palpate, and you're gonna do it in the same order of the quadrants as you do your auscultation. And you're gonna feel like lightly. You're gonna feel for any hard masses, any distension, any kind of tenderness, any pain in the abdomen. And then you don't want to do that before you auscultate, because if you do, it's going to cause your vowel sounds to be hyperactive to what they normally would be. I think that's it.